When we think of chronic neurological conditions, we often picture them as affecting much later in life. But multiple sclerosis tells us a completely different, much more startling story. In this video, we shift our focus from microscope to patient timeline to explore exactly when the symptoms first begin and show up in patients. Using the real world clinical data from a study of 940 patients, we break down the demographic of this condition. Whether you are a medical student, a clinician, or someone wanting to understand the real world impact of multiple sclerosis, this data reveals why the disease is uniquely challenging for young adults entering the prime of their lives. The data curve immediately shatters the misconception that this is an older person disease. If you look at the tallest bar in the graph, you will see a massive spike right at the 25 years old. This peak incidence year, the single most common age for a person's symptoms to appear first. Furthermore, the median age sits at 27, meaning exactly half of the 940 patients followed in this study experienced their first symptom before hitting their late 20s. Because there is a long gradual slope of diagnosis trailing off to a patient in 40s, 50s, and 60s, the overall mathematical average or the mean age is pulled slightly higher to 30.6 years. However, look at the outer edge of the graph. You notice how incredibly rare it is to see a diagnosis before the age of 12 or after the age of 60. The data clearly warns us that the concerned danger zone for multiple sclerosis onset sits square between the ages 20 and 40, directly impacting the individuals during their most critical year of education, career building, and starting families.